Nisha Jhalani. I'm a cardiologist at Columbia University Medical Center. I also work with the Cardiovascular Research Foundation as the director of the Women's Heart Health Initiative, which we founded about a year and a half ago now to raise awareness about women's heart disease among the general public. Heart disease is the #1 killer of women. I think that goes under-recognized, and it's also not talked about. So that's what we're trying to change, to start opening the conversation and the dialogue about how prevalent heart disease is and how there's so much that we can do to identify the women who are at risk earlier and hopefully give them the tools and knowledge that they can use to prevent having adverse events in the future. I think one thing that people don't realize is that there's so many risk factors out there that you don't feel, right? So we talk about, everybody knows that diabetes and high blood pressure are risk factors for heart disease, but people could have these and feel perfectly fine. And I think that a lot of us, especially, if we feel fine, we're not going to go and see a doctor. Life is too busy. There's too many other things to do. So I think it's important to stress how much people need to really take an active role in their health care and really go to see their doctors on a yearly basis, every 2 years, and really get screened the way that they should. So I think it's also important to understand that you can see a cardiologist if you think that you're at risk for heart disease, but don't yet have heart disease. And for me personally, I think those are some of my favorite visits, are the ones that are for individualized risk counseling and just going over, a person's personal risk for heart disease. You really delve into family history and diet. You get to talk about sleep and stress and all these things that factor into heart disease and are major risk factors, but don't get a lot of attention because we don't have a pill to treat it. Again, heart disease is the #1 killer of both men and women. I think women don't know that as much, and we don't focus on really taking control of our health as much as we should. We're so busy taking care of everybody else. And so the take-home message really is something that we want to empower people by giving them knowledge that they can then share with their loved ones, and then focus on, sort of middle age, what does it mean if you have symptoms, what are the symptoms you should be looking for, and kind of focus on what we call bread and butter heart disease. And then we wanted to focus on also sort of diseases that we are less apt to talk about, but valvular disease and things that can really affect the elderly population. Now recent technological advances that allow us to treat that and kind of have changed the natural history. A topic for tonight is healthy aging of the heart. It's kind of a broad topic, right? So what we tried to do was talk about 3 different stages. When you're in your early 20s, 30s, prevention of heart disease, but something that it's not just applicable to the 20s, 30s, something you can carry on for the rest of your life. Then sort of middle of your life, what are symptoms? When you start to develop symptoms, how do I know what to do with that? And then diseases of the elderly, and one in particular that I think that's really been a hot issue over the last couple of years, and I think will educate a lot of people about something that is very prevalent. So with that, I start with 10 tips to defy heart disease at any age. So again, this is something that I think the oncology community has done a very good job at setting age cutoffs for when you should start thinking about something, right? So you should have a mammogram at 40, you should have a colonoscopy at 50, you should, there's cutoffs for everything when you get tested. But there's not really a cutoff for heart disease, right? When should you start having the conversation? When is it important? And I think that cutoff should really be age 20. And people are shocked when they hear this, right? But 20 is kind of when you start to develop your habits for adulthood, right? So think about it. You're going to decide in your 20s, in your 30s, that you're going to be this kind of grown-up. You're going to eat well, you're going to exercise, you may or may not sleep, you're going to be all about work, you're going to be all about something, right? So this is where you really start to form the habits that are going to be with you for the rest of your life. And it's about having a conversation about heart health. And they've done studies where they talk to internists, or they ask patients when they go to see their internist, how many times does heart disease come up, your risk of heart disease come up in your 20s? And it's actually shockingly low. And it's because, primary care physicians are also not thinking about heart disease at the top of their thing. They're thinking about all the other things they have to talk to you about. So it's really up to the patient to bring it up and to say, what is my risk for heart disease? And let's talk about what I can do moving forward. So age 20 is when everybody should start the conversation, and it should be about your personalized risk, right? And the reason is because people don't know what they don't know. So many of the risk factors for heart disease, which I won't go over it at nauseum, but just the ones that come to the top of your head, right? High blood pressure, high cholesterol, diabetes. There's not a light that comes on that's like, oh, you need to go see your doctor because something's wrong. People can walk around with high blood pressure for 20 years and not even feel it, right? You could be a diabetic and it could be wreaking havoc on your arteries without actually, feeling anything. So you don't know until you have regular screening. So I really urge all of my young patients, everybody, to have regular screenings with their doctors. When you feel well, it's easy to ignore it, but it's really important. So tell people in their 20s that they have to still go to their well visits. And then take control of your numbers. When you go to the doctor, you should really be equipped with the information that you can talk about, right? Because you want to have a knowledgeable conversation with your doctor. So knowing that you don't have to memorize them, don't write them down, because we're going to give you magnets that have all the numbers written down, so you can take the magnet to your doctor. But essentially, knowing the cutoffs for things. So the new blood pressure cutoff is 130, right? So a top number greater than 130, a bottom number greater than 80, you're hypertensive. Whereas before it was pre-hypertension. And then your cholesterol, it's good to be able to break it down. So a lot of people will say, well, my cholesterol was 200. And you're like, well, that doesn't actually tell me anything. Was your triglyceride 200? Was your total cholesterol 200? So the number itself actually matters, and knowing what you're talking about matters. So total cholesterol groups up everything, right? There's HDL, which is the good cholesterol. You want that number to be high, right? So for women, we want that to be above 50. There's LDL, which is the lousy cholesterol. And that, depending on how much you're at risk, your goal is going to change. So if somebody is a diabetic or if they already have heart disease, I tell them that you want that number as low as you can possibly get it. You want it to be, 50. So less than 70, but as far down as you can get it. And if you're, sort of somebody that has maybe one or two risk factors, or you just really want to, you're an overachiever, you can have your LDL less than 100. That should be your personal goal. The general population, if you have no risk factors and you're an otherwise young person, LDL less than 130 is the goal. So it really depends, again, on your personalized risk, and you won't know that until you, go to see a doctor. And then the triglycerides is kind of the fatty stuff in your bloodstream, right? And that, you want that number to be less than 150. I'm sorry, am I blocking? The body mass index I won't get too into, because don't memorize the formula. Obviously, you can Google it on your phone and you can calculate it that way. But essentially, being at a healthy sort of body mass index or weight is important. And the worst kind of weight that you can have is actually the abdominal weight, right? So it's not so much, don't focus on the overall weight, but the sort of the central, gut weight is really the unhealthy stuff, right? So tip number 2, pay attention to the pregnancy stuff, right? And this is why we have to start the conversation so early. So what happens, people have kids in their 20s, 30s, 40s, what have you. You're so focused on, you go every 2 weeks to the OB and you get all your OB care diligently, and you have, 10% of pregnancies are actually afflicted with either gestational hypertension or preeclampsia, both of which are risk factors for future heart disease. But, these young people, then all of a sudden you have a child, you're cured of this pregnancy ailment. You don't even think about the fact that you're at risk for future heart disease. So warped with having, having a newborn to take care of, that people just ignore all of their future care. So, pregnancy is really is nature's stress test. It's your body's way of stressing itself, and things that come up, issues that come up during pregnancy, actually have long-lasting events or effects. So like I said, 10% of pregnancies are affected with either gestational diabetes or hypertension, both of which increase the risk of heart disease in the future. It doesn't matter if it's treated well during pregnancy with medications, it still increases your risk in the future. And it's worse with patients who also have, or women who also have small babies, right? So small for gestational age babies or preterm labor. Gestational diabetes also greatly increases the risk of developing type 2 diabetes in the future. Despite all of that, and that being common knowledge, it's still common knowledge amongst the medical community. It's still shocking that less than half of women will actually go to their follow-up appointment to get their glucose checked. So after having a baby, you're supposed to get your glucose checked, make sure that you're no longer still a diabetic. And it's because women are so, especially new mothers, are so busy taking care of everybody else, we ignore that fact. course, the risk is lessened if you do, healthy lifestyle habits immediately after. So tip number 3 to defy heart disease is eat right. It's easier said than done, right? There's so many different things that we could talk about. This should be an hour-long seminar on its own. So we'll just touch on the basics, right? The general gist that we talk about the Mediterranean diet, good fats versus bad fats, a diet that's low in saturated fats, trans fats, right? So red meats, processed foods, things like that, is what you want to aim for. Again, there's such a thing as good fats, so the polyunsaturated or monounsaturated fats that's found in fish, nuts, especially walnuts are good, avocado, olive oil, right? But it's kind of a double-edged sword. So, everybody talks about low fat. The cardiac diet is low fat. But what happened really is that, when the whole low fat thing happened in like the 80s and all that, and then look at the base of the pyramid. The base of the pyramid is carbs, right? So what happened is that there was a rise in obesity and diabetes. So it's kind of, you have to, again, it's all about your personalized risk. If you're somebody that has sort of borderline sugars, making the base of your pyramid carbs is not a good idea. Just think about it in real terms. If somebody says, what is the best diet I could do? Eat real food, right? So Michael Potts says that in the book up there, Eat Food, Mostly Plants, Not Too Much, right? So that's pretty much sums it up. You want to get your, people ask about supplements and what pills should I take. Like, don't spend $1 million trying to buy, supplements over the counter. Eat the real vitamins and minerals that comes from, plant-based sources of protein. Number 4 is drink right. So 8 glasses of water, that's what you hear from, when you're a kid. 8 glasses of water, and that'll be good. If you actually do that and then you stop, you'll notice a significant change. So if you drink 8 glasses of water, all of a sudden you have more energy. When you eat smart because you're full longer, and it really changes the way. And then if people are, all of a sudden deprived of their water, it makes a significant difference. No sugared beverage or energy drinks. They're like the bane of my existence, but just don't do it. Caffeine is this big thing, right? So even if you have heart disease, it's not like caffeine is your enemy. You just want to do everything in moderation. So 1 to 2 cups of coffee or tea daily is what I tell my patients. In general, that's a good rule to live by. And then alcohol, I almost left this off the slide. But I was like, somebody's going to ask. Because it's really a mixed message, right? So the word moderation comes into effect. What that means for women is one alcoholic beverage, preferably wine, a night, up to 7 in a week. Anything more than that is excessive, right? So it's either a lot. Some people are like, oh, that's so little, but some people are like, oh, that's a lot, right? So it depends on who you are. So moderate is the word, and there's studies that are out, and people always talk about how wine is good for your heart health, and it's true. There are certain ingredients in red wine in particular that have sort of protective effects against, raises your good cholesterol, and it can have protective effects against heart disease and stroke. That being said, anything that's more than moderation, or what is considered moderation, is very harmful to the heart. So if somebody is predisposed to arrhythmias, alcohol can actually induce atrial fibrillation, which is an arrhythmia. And it can increase the risk of heart failure, strokes. It's directly toxic to the pump function of the heart, so it can induce heart failure. So that being said, everything in moderation. Number 5 is don't smoke. Hopefully that's just like a no-brainer to everybody. But one thing that I know about cardiac, and I'm guilty of this as well, is when patients, if you do find a smoker, we are so ill-equipped to be able to offer any solution. So just in case you have a loved one who is a smoker, there are always options. Treatment includes replacement therapy, but there's also medications that they can take, usually prescribed by a primary care doctor, that can help to quit smoking and decrease the urge. We're actually terrible as a cardiologist. We're terrible at actually helping people quit smoke. We just tell them to stop. And I won't go through all this just for the sake of time, but if you think about how toxic it is to your bloodstream, you know that monitor that you have next to the smoke alarm, the carbon monoxide detector that beeps when things are too high? Well, that's what's in cigarette smoke, and 12 hours after you quit, your levels go back down to normal. So just think about, like, there's an alarm in your house that goes off, and smokers have high levels of that in their bloodstream. Number 6, get moving. Exercise is literally the best medicine because it has pretty much no side effects, right? So no matter how little, it has positive health outcomes. people sleep better, it slows down the aging process, it's a more productive work day, you have less aches and pains, people with arthritis, the exercise actually helps. A decrease in almost every chronic illness that includes high blood pressure, high cholesterol, diabetes, obesity, heart disease, stroke, name it, right? Alzheimer's and multiple different forms of cancer. So it really is a sort of the best medicine that we have. What's recommended is 150 minutes of moderate intensity exercise a week. What does that mean? Walking is moderate intensity exercise. For people who sort of need to do intense exercise on the weekends because there's no time during the week, they say 75 minutes a week. But really you want 150 minutes, 30 minutes most days out of the week. Number 7 is sleep well. So we, right? I Googled sleeping well, and this was like one of the first days. It made me so happy. So this kid is like happy as a clam, right? But sleep well. 6 to 8 hours is the goal. And so if you sleep less than 6 hours a night or more than 8 hours a night actually have adverse outcomes. You know, sometimes if you sleep too much, you feel worse. It's been shown in studies too, it's not just you. So this was like just something interesting. So actually, if you look at like Eastern medicine, Ayurvedic medicine, 6 to 10 p.m. is the time where your body is supposed to slow down, right? And that's not the case for most Americans. But 6 to 10 p.m. is when you're supposed to slow down. 10 p.m. is the natural bedtime. And if you look at nature, birds quiet down between that time. You know, animals try to find some place to sleep for the night. So it's very interesting. It's the body's chance to shut down. So as a mother of 2 little babies, I say all the time that like I will move mountains to protect bedtime because it's when their brains grow. But it's true for adults too. Lack of sleep can cause a whole bunch of things affecting your blood pressure, your heart rate, and all of that. Number 8 is de-stress. So we have studies, and again, I'm running out of time, but we have studies showing that chronic high levels of stress, this is New York City, so high stress meaning bad stress, right? The stress that keeps you up, keeps you at night, and you can't sleep, or gets your stomach in knots. But chronic high levels of stress actually cause changes, increased uptake in certain parts of your brain called the amygdala that links to increased inflammation in the arteries. So it actually has been shown that people with chronic high levels of stress have increased inflammation in their arterial walls that predisposes for plaque. And this is just a fancy picture of that, but see how over here, there's not a lot, this is a low stress, low amygdala activity, and then over here it all lights up. So it's increased sort of uptake in the aorta or the main blood vessel of your heart. Number 9 is make time for yourself. So even if it's just 10 minutes at the end of the day, just find some time to unwind, think about the day, to just zone out your to-do list and the check boxes, and just think about yourself and try to center yourself. It makes difference even if it's just, again, a few minutes a day. And again, meditation and yoga decrease stress levels, they decrease amygdala activity, lowers your blood pressure, lowers your cholesterol, slows down your heart rate. And number 10 is share what you've learned. So the first step is having come here. The point is really start the conversation, not only with your doctors, but amongst each other and amongst yourselves and your loved ones. It's not that what is out there is that heart disease is a man's disease, and that, men with heart disease, that's just something that happens to them. But women with heart disease, they must have taken really bad care of themselves. So they must have been really unhealthy and eaten fast food and done all these bad things, and that's just not the case. So heart disease is the #1 killer of men and women, and there's a stigma that women associate with heart disease. They don't want to talk about it. People feel ashamed, and that's something that we need to change, right now. So it's important to talk to yourself, your loved ones about heart health risk, with your doctors as well. And there's certain things that we say are, when you talk about cardiac risk factors, things that we can change, things that we can't change, right? And the things that we can't change, obviously, are how old you are, your race, your biological sex, things, your family history. Those things you can't change. But even the things that we say people have control over, right? High blood pressure, high cholesterol, diabetes, those preeclampsia, all of those things have a genetic predisposition. If your family members had it, you're more likely to have it yourself. And so there's no stigma associated with having any of these conditions, but we know that if you do something to try to, modify your risk, either through exercise, diet, all of the above, it really does make a difference. They've done studies where people with the highest genetic risk adopt healthy lifestyle habits, kind of optimize everything that they can do, and they actually cut their risk in half. So it's not for nothing. So thank you for joining us today.